So my disclosures. So dialysis access maturation. Whenever we talk about maturation problems, we mean fistula maturation problems. Grafts and catheters do not have this problem. So it's a well-established problem, but there is no well-established definition about that. It's the process in general by which a fistula becomes adequately delayed and enough the dialysis throughout the sessions. So we all know that maturation problems or failing fistulas is a big problem, 20 to 60% regarding of the country that is published. Differs. So in the States, there's a slight increase in or big increase in maturation failures than in the Europe country regions. So the process by which a fistula becomes mature, the physiological process, requires two vessels and two healthy vessels. That is not always, or that is mostly not always the case in our patients. That the artery will dilate, so the peripheral vascular resistance will fall, so increased blood flow goes through the vein, and the vein becomes dilated and sufficient in blood volume enough to support dialysis. So this requires three factors: a healthy and adaptive artery, a skilled technician, thank you, a skilled technician, a skilled surgeon, and a healthy also vein. So let's review the facts. We all know that in the last decades, dialysis patients who are starting dialysis are of advanced age, with most of them have hypertension, and around half of them have also diabetes. These comorbidities lead to calcified and non-compliant arterial vessels, sclerotic veins, and of course the decreased cardiac output plays also a role. So this leads to abnormal vessel adaptation, impaired vessel diameter increase, and finally you get a fistula that has a low, if any, has a low arteriovenous blood flow. I'm sorry. So what did this great publication show us? The hemodialysis fistula maturation study. Three simple things, the rule of 6. So the most important predictive factor for a fistula to be mature was the depth of the vein. So depth of the vein, blood volume, and diameter, three very, very important factors, very predictive of maturation. So is there a way ahead? I will not review all of these publications. You have better know the results of various endovascular techniques in this field. I will just review some of the surgical techniques, although I'm not a surgeon. So this groundbreaking publication by Prabir and colleagues in Cincinnati, 2012, did make a great impact back then. We were invited to make a comment about this new technique. So what did Dr. Prabir do? He managed to have a PIC model with a curved anastomosis, and this curved anastomosis had a better flow rates than the standard technique. Later on, another device was introduced with various and not so promising results. And in the field of different surgical techniques, this so-called slot technique, it's a way of doing almost side-to-side anastomosis between vein and artery, did show some very promising results in this publication. Another technique is the radar technique. It's a transverse or a reverse Dressel Shimino. So instead of anastomosing end vein to side artery, you do the other thing. You anastomose end artery with the two veins with the two veins of the artery into the cephalic vein. So this is a minimal invasive technique, avoiding any stenosis and any juxta-anastomotic stenosis. And as you can see, the authors did compare their results of the radar technique with historical data with quite promising results. Karidis Nikolaos is a guy from our hospital, did publish this device, the vascular device. Unfortunately, no functional patency, no assisted maturation and unassisted maturation rates or results were promising enough, but still there is a way ahead for this procedure also. So far, infrared therapy, a meta-analysis from China included in the KDOQI and the European best practice guidelines. It's a device that has a thermal device that is implemented during the dialysis session with quite promising results in terms of blood flow. And this is an announced randomized control trial in the UK that should be published in later years to come if the pandemic has not. So Fist Assist is another external pneumatic device that has been shown to increase blood flow rates and some kind of exercise to the brain. And lastly, this amplified device, we talked about it with Dr. Kittos a few weeks ago. It has been announced, but not yet clinically proven of these results. So this is for me. Thank you very much.